For almost 2 weeks now, Zubeida has dedicated herself to taking care of a little bundle of joy born at Mbagathi Hospital. Her baby was 1.4 kilograms at birth and had to be put under specialized care, as is the case for all the other children born underweight. When she gave birth on the 19th of February this year, Zubeida was full of joy since hers was a complicated pregnancy. Actually, the child came in a little earlier than was expected.
Sikuwa na mambo mbaya.
Hukuwa na wasiwasi labda?
Sikuwa na wasiwasi sababu mtoto alipotoka alilia tu vizuri, alikuwa tu active.
That joy was short-lived though. Her baby was underweight and had to be put into an incubator. This, she says, left her with mixed feelings.
Nitangu sijaiona incubator, sikuwa najua Mbagathi na sikuwa najua kama naweza hudumiwa kama venye nimehudumiwa saa hii.
More often than not, many people are not aware that such facilities can actually be found in county hospitals, perhaps explaining why there are many referrals to the national hospital.
Enyewe sikuwa najua kama naweza pata vitu kama hizi huku, nilikuwa nafikiria pengine Kenyatta ndo inaweza tu.
Zubeida is amongst many residents of Nairobi County who are unaware of the services offered at this facility, especially in the area of maternal and child health.
Well, it's an age-old feeling amongst members of the public that government facilities are grossly deprived. And that is not necessarily true. As you see here, this hospital is not really deprived, at least not of the most basic things. We're able to give very good care to our newborn babies, both severely premature, mildly premature, and also term infants who are unwell.
Records show that a sizable number of county governments are investing heavily in healthcare provision. Equipping of this maternity and newborn unit at a cost of 200 million shillings is an example here in Nairobi County. Yet not so many know of the state of health facilities in the counties. Apart from bringing services closer to the people in this area, equipping the newborn unit with state-of-the-art medical appliances helped reduce congestion at Pumwani Maternity Hospital and also KNH.
The newborn unit came in as a result of the challenges we are having in taking care of newborn. It has a capacity of 40 incubators, but at the moment we are only using 20 incubators.
No doubt having sufficient incubators in any health facility plays a critical role in the promotion of child health, a concern the county government says is key on its agenda.
Severely premature babies, those are babies who are under 1,500 grams, require incubator care so as to mimic the condition in the uterus. Without the incubator, it is not possible to keep a very little preterm baby warm. So the incubator gives the optimum conditions for these babies to be kept in so that they have the opportunity to grow, first to stay alive and then to grow.
But the possibility of giving more children a chance to survive is hindered by the lack of sufficient nurses at the hospital. This is despite having extra incubators.
But because of the demand and the number of deliveries, that is why we have 40. But again, because of the limitation in terms of the staff, that is why we can't set up all the 40. We have the space to set up 40, but we cannot set up all the 40 because we need more staff to be able to manage them.
As we speak now, we are doing gap analysis of all the healthcare providers or the candidates. After we identify the gaps, this is taken to the Public Service Board, whereby we advertise for the positions. Yes, I agree 100% that we don't have adequate healthcare providers in the county, and since we are in that process, I see a situation whereby we'll be in a position to address that issue adequately.
We set out to another hospital to find out what the county government has done as far as maternal and child health is concerned. Our tour of health facilities in Nairobi County also got us to Pumwani Maternity Hospital, which is not only the largest referral maternity hospital in the country, but also the region. Inasmuch as this facility has been in existence since 1926, Pumwani has been struggling with image problems. But the hospital is now changing face.
There's no shop for selling babies in Pumwani. There's no shop for buying babies in Pumwani Hospital.
The welcoming doors of Pumwani Maternity Hospital tells you of a changing Pumwani that is now painting another side of the facility.
Wamenisaidia. Because kwao mtu angesurvive.
This is a side of Pumwani that a lot of people, and especially residents of Nairobi, do not know about. A side that the county government wants to be understood, if at all the hospital is to carry out its mandate of promoting maternal and child health confidently.
We have a plan of building a new or refurbishing the hospital to a tune of 600 million, and already as we speak now, the tender, the documents for the construction are already. We are already now in the final stages of production of BQs, so that we start construction of the hospital, because we believe strongly in investing heavily on maternal child.
Sharon Atieno is among the 80 to 100 women who give birth at this hospital on a daily basis. Sharon has had to stay a little longer in hospital after giving birth through a cesarean section. Here we are keen to find out about the notion that children are often separated from the mothers, a concern that many say is what gives room to fishy dealings.
Nilitoka tu direct from theater, nikaletwa hapa, nikapata mtoto. Yeah. From there mpaka sasa hivi nimekuwa tu naye nikimnyonyesha.
Hakuna mahali watoto wanapeleka.
Hapana.
Na ulikuwa umesikia story kama hizo?
Yeah, but sasa unajipa moyo si wote. Because mimi sija witness kitu kama hiyo. Yeah.
We do not separate the baby from the mother. The baby stays with the mother unless subsequently the baby develops a problem. That's when we will take the baby to go and treat the problem.
Although not disputing the claims of baby theft reported in this institution, the new health executive in the county is confident that the hospital is now changing.
I can assure mothers that a child will not be changed from one mother to another. That will not happen. Neither will you get the scandals of a child disappearing from that facility.
From the time you enter the gate at Pumwani Hospital, if you are a woman, there's a rubber stamp. So when you walk out, we check the stamp that we put on you. Is it the stamp for a mother who brought a baby to the clinic for immunization? Or is it a stamp for a mother who walked in labor and now will be walking out with a baby? Or is it a rubber stamp of a relative who brought in a pregnant mother in labor? So we have our own security system working to look at the stamp. So if you walked in without a baby and you walk out carrying a baby, you must question, where did you get this baby?
It is such assurances that Sharon says gave her the confidence of coming to this hospital despite the many stories she had had. Like Zubeida, whose child is receiving care at Mbagathi Hospital, Sharon was also not aware of all the services here at Pumwani, clearly depicting that despite the monetary investment in areas of maternal and child health in Nairobi's hospitals, the two hospitals show that the county's health department would have to invest heavily in restoring the public's confidence in its facilities. This is apart from creating awareness from time to time. Irene Choge, NTV in the County of Nairobi for the Health Assignment.